next topic is healthcare debates and controversies in medical sociology. Debates and controversies in medical sociology. These are all those aspects which are still under consideration. There are no certain answer to these questions. Like if a person is dying and the doctors know he is dead and they put him on the ventilator, so is it like justified or not? Should the doctor let him die or not? These are medical questions that are often under consideration or often taken care of. Healthcare access and inequality. Healthcare access. People living in rural areas do not have that good access to healthcare, while urban areas have better facilities. Inequality comes when when the elite class get more profit and the middle class or the lower class doesn't get good quality of healthcare. Inequality occurs. Often inequality also occur because of inadequate resources. Universal health coverage answers whether and how to implement universal health coverage, especially in countries like where healthcare is not connected as an universal right. Impact of social determinant. How social determinants of health such as housing, employment impact health outcomes. Medicalization and over medicalization refers to the process by which humans designate a problem as a medical condition, while over medicalization is medical the when the medical fields where the medical field that is not required come into action. Normal life events like childbirth or menopause, when these conditions are considered a medical problem, this is called as over medicalization. And the pharmaceutical companies also play a major role in medicalizing of everyday's. Ethics in medical research. When we are taking someone for research, we should know how the research is to be conducted, how a person's autonomy is being affected, how a person's personal aspects are being affected. So consent and autonomy are a must. Allocation of resources, the fairly distribution of resources, as we have already discussed. Impact of technology and healthcare. With the digital health and tools, the healthcare outcomes have improved, but privacy and data security issues are being raised. As we all know, artificial intelligence in healthcare, AI role in diagnosing and treating patients, and the ethical implication of machine learning. Global health and equity. Global health and equity is being discussed over worldwide, but there are still some debates over it, as some culture in some areas, in some cultures it is prohibited to get blood donation, and even if they are dying they don't get blood donated. So cultural interventions, health equity. Equity, you should know that equity is different from equality. Equity means everyone gets the rights they deserve according to what they need, and equality means if a person is having one bread and the second one is having one bread, while equity refers to that if a person needs one bread and the second one needs two breads, then the second one should get the two breads. Okay. Then chronic illness and disability. These are like, if a person is disabled, should we let him live in the society? He would become a burden to the society, he would be unable to do his normal, so should we do this? And chronic illness management. How do we manage chronic illnesses? These all for